So there we go. Perfect. All righty. So let's go ahead and let's see. We are 2 minutes early. So if you are new here, this is actually our third menopause, perimenopause, and hormone Q&A that we're doing here live on YouTube. So if you have questions, you can ask them in the comments, and I will be checking those as we go through. We are going to be checking everything hormones, menopause, perimenopause, hormone replacement, symptoms of menopause, how to deal with them both naturally and with hormones. So it's pretty much an open book. We're just going to try to keep it on topic for hormones and female hormones and menopause and hormone issues and stuff like that. So if we do have other questions that are about other health conditions, we can definitely do a future Q&A that's more general. But one more thing, we want to keep it PG. So although we will be talking about things like vaginal dryness and low libido, we want to keep the comments clean so that we can keep this video up on YouTube. So thank you so much for joining me. And thank you so much if you subscribe to my channel, because we just launched this channel about 2.5 weeks ago, and we just reached 1,000 subscribers. So not only is that like really exciting for me, but the reason is that we're able to get these messages out to more and more women. The more content, the more information, and the more kind of empowerment that women have about their health and hormones, and with all the misconceptions out there currently about menopause, perimenopause, hormone replacement, how difficult it is to get answers from your general practitioner or your gynecologist. This information is so crucial. So I really want to be sure that we get this information out. So you're definitely helping every time you comment, every time you share, and every time you subscribe. So thank you so much for that. So I'm going to go ahead and get into some questions right now. Some people did definitely ask questions earlier, so I will go ahead and start answering. I have my iPad here where I have the questions pulled up, so I don't have to keep switching back and forth on my screen. So first question I have is, let's see, when all energy is gone and I can't even stand anymore, what is wrong other than chronic fatigue syndrome? I've tried supplements, but it hasn't helped. Eating healthy, and hypothyroidism too. So if you have hypothyroidism, that is basically low thyroid. So hypo is low and thyroidism is thyroid. And so our thyroid is our energy producer. So when we have low thyroid hormones, you're going to be tired. So you definitely want to get help for that thyroid imbalance. And then also if you are in the perimenopause, menopause age, your mitochondria are slowing down, how your body creates energy from food changes. And so definitely diet, lifestyle, getting enough sleep is going to be really important. And as we reach perimenopause and menopause and our progesterone levels decline, sleep is often definitely sacrificed, and it's not as restful. Oftentimes we have trouble either getting asleep or staying asleep. And also research is now showing that low melatonin or lowered levels of melatonin, which is our sleep hormone, actually decline as women hit perimenopause and menopause as well. And menopause is a time when we definitely need our sleep more than ever. And melatonin is actually a very powerful antioxidant. Not only is it helpful for gut health and gut healing, it's helpful for definitely sleep and restoration. It's important for our immune system, and it's important for sex drive. So there's a huge correlation between melatonin levels and sex drive. So taking melatonin is a great option if sleep is actually struggling. So hopefully that helps with that question. Of course, it could be a variety of other health conditions that can be creating that fatigue. So we definitely want to consider going to a naturopathic or a functional medicine doctor to get a complete workup and look at your history and your exposures. We have many clients who have been exposed to mold, and myself included. A couple of years ago, we went to Puerto Rico and we were staying there for a while, and I was exposed to mold, and I gained like 20 pounds in 3 months. I was fatigued all the time. I felt like I was sick all the time, and I started getting congested. I started getting migraines for the first time in my life. And so that was actually mold was the root cause. Also, Lyme disease could be a factor. Long haul COVID can be a factor. Long haul pneumonia could be a factor. So there's so many different possibilities, but the hormonal component can definitely be there. Low DHEA, which is the precursor to testosterone. It's also our anti-aging hormone. It's also our energizing hormone. So that could be an issue as well. All right, I'm going to move on to the next question, but thanks for asking. All right, so next question is, I'm desperate to lose weight in my belly and hips due to hormones, tired of hot flashes, thinning hair, and fatigue, and can't get enough water, please. All right, so I know when you said you can't get enough water, I'm guessing that you're saying that you're thirsty all the time. That could be a sign of diabetes or pre-diabetes. So you want to definitely check your blood sugar levels, because imbalanced blood sugar can lead to belly fat and fat around the midsection. It also can be increased hot flashes can be affected by increased blood sugar. So it could be insulin is the hormone that could be your problem. However, it's very, very common in menopause to have hot flashes, fatigue, low energy, and these are symptoms of lowered estrogen. So estrogen is our hydrating hormone. It's an energizing hormone, and it helps to maintain our ability to have a woman, kind of that hourglass silhouette. So the smaller waist, bigger booty, breasts, things like that, to give us that womanly shape. As we lose estrogen, we kind of go from being that silhouette to kind of being like an apple. And that is because we change the where we store fat. Also, when estrogen drops, we have a lot of physiological changes that happen in our body. Number one is when estrogen is lower, inflammation tends to go up, and that inflammation can increase cholesterol. So you can find yourself all of a sudden having higher cholesterol levels than before, and your doctor might recommend a statin. He might recommend some other medications, and you might just need to replace that estrogen. Also, blood sugar. So your blood sugar can go up when estrogen drops, as well as can your blood pressure. So getting your hormones tested is probably a really good step if you are over the age of 35. So anyone over the age of 35 can really, really, really benefit from getting their hormones tested, looking at your estrogen, looking at your progesterone, looking at your testosterone, looking at your DHEA, looking at thyroid, even cortisol levels and melatonin. All of those can be super helpful, but for the sake of menopause, at least the sex hormones, so at least the estrogen, progesterone, testosterone, and DHEA. If you're noticing all of a sudden when your period started changing, you notice some of these other changes as well, or you're noticing, okay, when I hit my 40s, 45, 50, I started noticing these issues, then it definitely could be your sex hormones. I would also check thyroid though, because a lot of times thyroid dysfunction goes misdiagnosed or not diagnosed, because the symptoms of low thyroid and the symptoms of low sex hormones can kind of go parallel. And so a lot of women don't get the help that they need because they're not looking also at thyroid. Awesome. All right, next question. Let's see, I had a hysterectomy last year and I can't heal ever. I always have low back pain, pelvic pain, more problems now than ever, breast tenderness, dry hair, fatigue, bone pain. So lots of problems following the hysterectomy. Very, 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 very common. So when we go into menopause, natural menopause, that's when our ovaries stop working. And there is a kind of a little bit of a gradual decline, but also it kind of drops off. So it's like, then boom, it falls off at menopause. When you have a hysterectomy, especially if you've had it prior to the time when your hormones make that steep drop, you're going to automatically get that steep drop as soon as you have that surgery, especially if you have your ovaries removed. Now, if you don't have your ovaries removed, you usually have about 5 years from the time of the hysterectomy before your hormones drop. So it's kind of like throws your body unexpectedly into this menopause state. And you can notice more pain because estrogen is anti-inflammatory. It's actually lubricating for your joints. So it's hydrating. It's hydrating for our skin and our collagen. So we get like that nice, youthful bounce back of our skin. It's hydrating for our joints. It helps our blood vessels be more pliable. It helps lubricate our vaginal tissues. It just helps overall. And so estrogen is super important. Progesterone as well. Progesterone helps. It's like a nerve tonic. It helps kind of calm our body, helps to reduce inflammation. Estrogen and progesterone together help with gut motility. Progesterone helps with sleep, helps kind of combat depression and all of those things. So definitely hormones can be at play, DHEA as well, fatigue, and testosterone, fatigue, low energy, low confidence, all of those things can definitely be come into play. And then the pelvic pain as well, it's super common. As we go into menopause and we lose our hormones, our tissues can change. And so we have thinning of the tissues, we have atrophy, we have dryness, and we can also have a shift as the connective tissues become less stable and more lax. You can have shifts, and that can create some pelvic pain as well. And we don't want that. So definitely looking at your hormone levels, and then also looking at your nutrition, your lifestyle. Are you getting outside in the morning? Are you really having a sleep routine, like a nighttime wind down routine where you're not watching the news and you're not looking at bright lights at night? Doing some type of stress reduction activity can be super helpful as well, because that's going to help regulate our cortisol levels. Cortisol has a huge impact in all these things as well. So all of our hormones, they work together, right? And so you don't just have an issue with estrogen. You usually have estrogen imbalance. You might have imbalanced cortisol. Your thyroid might be off. Your liver might be a little bit sluggish. So really, it's really a holistic thing, but I'm kind of simplifying here when I'm telling you what possibilities it can be, but there's usually more than one issue that we're looking at. Okay, here's another one. Kathy is constantly tired. Wake up tired, take a nap tired, numerous supplements, foods, work out at the gym 5 times a week. Bottom line, constantly tired and more tired. Okay, are you tired? Yeah, so she's tired all the time, so no energy. So first thing I think about is look at thyroid. Second thing I think about is look at the adrenal glands. So look at your cortisol levels and your cortisol pattern. So with cortisol is, we kind of vilify cortisol. We talk about it like it's bad all the time. It's not bad. It just has to be in the right levels at the right time. All hormones, for that matter. Someone had asked, and I'll address this a little bit later, about side effects of hormone replacement therapy. Well, it really depends on, are you having too much hormones? Are you having too little hormones? Are they imbalanced? But with cortisol, it really has to be at the right levels at the right time of the day, because in the morning, it should be at its highest point to wake us up. So it's actually a little bit lower when we first wake up, and then it peaks like within an hour of waking, and that kind of gives us our energy for the day. And then gradually throughout the day, it'll gradually kind of decline until it's at its lowest amount when melatonin is high and we're able to go to sleep. Now, if this cortisol is flatlined all day, either from chronic stress, from past infections, from past traumas, from over-exercise, from over-restricting food, from something in your environment, or just a stressful job, or a stressful husband, or a stressful life, or being in traffic every day, it could really be a lot of different things. If your cortisol is flatlined, you're going to feel tired all the time. One thing, if this is the case, so I definitely recommend testing your cortisol levels. You can do that through us. We have at-home kits that you can, this cortisol is a saliva test. So you do the 4 samples throughout the day, you send it in, and then we give you your results. So that's available through us or through your doctor. So you can definitely do that. We also do thyroid testing, hormone testing, all kinds of testing. And we can make that available to you guys at home. So you can just email us or pop a message in the chat, and we can give you that information. But so that's one, cortisol. Number 2 is thyroid. If your thyroid is low, your thyroid is what gives you energy to basically all the cells in your body. So your thyroid hormone, your thyroid makes T4, which is basically the inactive form of the thyroid hormone, and it has to be converted into T3, which is the active form of thyroid hormone. That's the thing that does all the good things. That's the thing that gives us the energy, all the things we think about with metabolism, energy. Thyroid is T3. So in order to make that conversion, you have to have certain nutrients. You also have to have a liver that's functioning properly. And then the T3 can actually be inactivated by something called reverse T3. And that happens when there's a lot of stress. So it's not just your adrenals that are affected by stress, it's also your thyroid. And then other reasons why you might have fatigue, mold exposure, chronic fatigue syndrome, lack of proper nutrition, chronic stress, not getting enough sleep. So maybe melatonin is low again in this case. As far as like sex hormones, definitely if your hormones are all in the tank, you're probably going to be tired all the time, and you're probably not going to be getting good sleep either. So definitely sex hormones can come into play here, but it's usually also going to be thyroid. It's also going to be adrenals, so your cortisol level. It might be a melatonin imbalance. It might be liver toxicity. You might have gut issues. So there might be a lot of things going on, but you should not feel that way. That's absolutely not normal. I definitely recommend getting some testing. So you don't want to guess. You don't want to just go online or go to even a pharmaceutical grade website or a doctor's website and buy all the supplements. You never want to buy supplements that say, give me more energy. It's usually not going to work. So you really want to know what you need to take, and maybe food, what kind of foods can energize you. You might even have a food sensitivity, so there could be a food that's sapping your energy and making you tired. So definitely looking at all those things can be, but Kathy, do not just stay that way. Definitely, that's no way to live. I don't know how old you are, but you cannot be tired all the time. It's not acceptable. It's not okay. If your doctor's telling you it's because you're getting older, find another doctor. Do not listen to that. You can be 80, 90, 100 and still have energy until the day that you die. And that's how you really should be. So if you're tired all the time like that, definitely not acceptable. Okay, Jane says, I'm 56 and I had my last full period last August. Okay, so that's so 1 year, 12 months from your last period is officially the day, that's the anniversary of 12 months of not having a period is your menopause day. So happy menopause day to Jane. All right, so that's her statement. And then she says, last April, my estradiol was 25 PGs per ml. My progesterone was 0.65. I have hypothyroidism. And my TSH was 1.31. Skin is dry. Thanks. So chances are, if you're in menopause, your hormones are going to be different from last April to now. Or did you mean just a few months ago, April? It's probably going to be similar. So your hormones are going to be low. So estrogen, super hydrating. If you have dry skin, if your hair is falling out, if you have brittle nails, if your vaginal dryness is a problem, estrogen is going to be a huge hydrator for you. Hypothyroidism will also kind of dry you out as well. So definitely looking at possibly TSH is not actually even a marker of thyroid health. TSH is the message from your brain to your thyroid telling it to make thyroid hormones. It's so outdated as a thyroid marker. And unfortunately, in conventional medicine, it's usually the only test they run, which is sad. You actually should be getting a complete thyroid panel. So we're looking at, you do still want to test TSH. It usually comes with the test. You want free T4, total T4, total T3, free T3, reverse T3, and the antibodies, so TPO and TBAG. You want thyroid antibodies, you want reverse T3, you want free and total T3, you want free and total T4, and you want TSH. So that is a decent thyroid panel. We offer those if you cannot get your doctor to order it for you. You should. A lot of times doctors won't order these things, so it's not their standard of care. Their standard of care is going to be to order TSH, and if you're lucky, they might order T4. Like if you're a really forward-thinking, basic doctor that's still following standard of care. The reason why they're not testing T3, they're not testing reverse T3, they're not testing thyroid antibodies is because no matter which thyroid dysfunction you have, the standard of care is to give you levothyroxine or T4, synthetic T4. Now, if you have enough T4 and not enough T3, that's a conversion issue. Guess what? They're still giving you T4. If you have thyroid antibodies, that's an immune issue. That's your immune system kind of attacking your thyroid. They're still giving you T4. If you have too much reverse T3, so that's basically toxicity, stress that's putting the brakes on your thyroid activity, guess what? Still giving you T4. And so that's why conventional medicine, they don't usually run the full test because they don't change the way they kind of help you, because if it's reverse T3, you need to look into detoxification. Your general practitioner is not going to help you with detoxification. If it's a conversion issue, it might be a nutrient deficiency. Your general practitioner usually not going to work with you on nutrient deficiencies. It's just the fact of life. It's unfortunately, that's what our insurance pays for, is they do the tests, you're matched up with the medication, and then you get the medication. And we don't usually, you're not usually going to get the full care unless you're working with a naturopathic physician or a functional medicine doctor, or sometimes I'll give you a little tip. If you can get a DO, they will usually be a little more functional minded, I would say. And so that can help. My iPad keeps shutting off, so I can't see your questions. All right, let's see. Let me go. Okay, I got some more. Okay, Michaela says, what are the main differences between your BHRT program, which is called the Healthy Hormone Club, and the GLOW protocol? I thought they were the same. Okay, so they're completely different. So our Healthy Hormone Club is strictly for hormone replacement. So we're going to test your hormones. You're going to meet with a hormone specialist. We're going to review your hormone imbalances. We're going to recommend hormone replacement. We'll ship you your hormones. We'll keep monitoring your symptoms and your hormones. We'll test you every 4 months, and we'll supply. So it includes your testing, your consultation, all of your hormones. So that's what that's for. We will give you also some guidance on healthy lifestyle, nutrition. We'll look at any supplementation that we think might be helpful for a hormone detox. We might recommend thyroid testing. We might recommend vitamin D. So we'll do anything related to the hormones. Now, the GLOW protocol, this is a complete natural medicine implementation program. So we are looking at your entire health history, not just hormone related. We're looking at everything that's ever happened to you. Did you have carpets when you were a kid? Were you exposed to mold? Did you have pets? Were you ever in a traumatic accident? Did you suffer from divorce? What kind of diet do you eat? What kind of exercise do you do? What are you exposed to? So we look at all of that, any past health issues, any current symptoms throughout your whole body, not just hormone related. And then we give you an analysis of what area of the body you might have dysfunction in. So we look at gut health, we look at immune health, we look at nutrient absorption and assimilation, we look at mitochondrial health. We do look at hormones, but we're more focused on blood sugar, cortisol, adrenals, things like that. But we do also talk about natural lifestyle solutions for hormone balance, which are going to work more for women who are still making hormones and less for women who aren't making hormones anymore. So if you're past the stage where you're still making your own hormones, then we can offer some natural symptom relief, but we won't be able to restore your hormones unless we're giving you hormone replacement therapy, which in that case, we would recommend that you do the Healthy Hormone Club hormone replacement program. We also look at, I think I mentioned detoxification. We look at cardiovascular health. We look at structural integrity, like skin, bones, muscles, things like that. So that is the GLOW protocol. It comes with coaching. There's a complete education portal. So it's a really in-depth program. So that's different. It's more of a do-it-yourself at home with coaching in natural medicine, head-to-toe implementation program. And the Healthy Hormone Club is hormone replacement therapy and support and testing. all included for one low price. We try to make hormone replacement therapy accessible and affordable for everybody. So we'll put a link down below this masterclass on when you have the replay, and it'll actually have a link to a hormone masterclass that tells you all about why you'd want to replace hormones, the pros and cons, the myths and misconceptions of hormone replacement therapy. And if you watch that entire masterclass, you actually get a huge discount on the hormone replacement program with the Healthy Hormone Club. So the little snippet. So if you go to our website right now and you go to Healthy Hormone Club, you'll see the price. But if you watch the webinar, you'll get like a half price discount. So little secret. I'm probably not supposed to say that. My marketing team's probably like, why are you telling everybody that? But we're offering it. So I just want to let you guys know that you can get that. Let's see. So hopefully that, if you have more questions, just pop a message or email to support@glownaturalwellness.com. That's support@glownaturalwellness.com. If you're watching the replay and you ask a question, I will be answering questions on upcoming videos. So I'm going to use this content that the questions that you guys are asking for more in-depth videos on this channel. So make sure you subscribe so you can get that information as well. Hi, Donna. Thanks for saying hi. So let's see. I get menstrual migraines every month. What can be done to help with that? I also have low ferritin. So menstrual migraines are usually because they usually happen due to the fluctuations in the hormones. And it's usually when estrogen and progesterone are either too far apart or progesterone's not climbing enough for most women. So looking at your hormones and possibly adding some progesterone can be super helpful, especially in the second half of your cycle. Also, things like ginger are very helpful, anything anti-inflammatory, but menstrual migraines are generally happening because your body doesn't like the sharp fluctuation. Your hormones are not generally going in the nice flow that they're supposed to, and there's a little bit of a, like it's usually like a this, and yours might go boop, 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 and so it's causing that that migraine issue. There's other reasons for migraines, but if they're happening at the same time every month, then definitely that could be an issue. But low ferritin can also be a component there. So getting enough iron, taking an iron supplement can be helpful, or eating iron-rich foods can be helpful as well to help with keeping things kind of more balanced for you so that you don't have those huge dips. Can pregnenolone balance hormones in perimenopause and raise estrogen? So pregnenolone is a little bit tricky. So with pregnenolone is kind of like a precursor to all of your hormones. And when you take pregnenolone, it can break down different ways on different days. So you don't really have control over which hormone you are affecting. So let's say you are estrogen dominant and you're trying to bring up your progesterone. Pregnenolone may make you more estrogen dominant. If you are trying to raise your estrogen, maybe it won't do that. Maybe it'll raise your progesterone. So it's just you're putting in a precursor, just like cholesterol is a precursor to hormones. So eating more cholesterol will give you more raw materials to make your hormones out of. However, you're not going to be able to direct which hormone you make. So the same things with pregnenolone. So it can bring up your hormones if you are cycling regularly. It can help to kind of balance things out, but it's not going to give you any control, and there's not going to be any rhyme or reason to why which hormones are balanced when. So we don't use that in our practice, but you can use it if you're trying to DIY. It's pretty safe to use, but it's not always going to produce the same result. So that's how that works. Let's see. Hi, I'm having my milk ducts chronically blocked. Please let me know what it can be related to. Is it related to hormones? Are you breastfeeding? Let me know if you're currently breastfeeding or if it's just getting blocked normally. It can be just like clogged pores. So that can be something that you can just apply a warm compress to, and that can relieve it. If you're feeling like you're getting fibrocystic breasts or you're getting like lumps or painful breasts, then that can sometimes be a situation where your hormones are imbalanced. Could be estrogen dominance. It can be lack of healthy estrogen detox. So one thing when we replace hormones, or even if we're not replacing hormones, we really like to optimize estrogen detox because we have so many xenoestrogens and fake estrogens in our environment, from plastics to pesticides to BPAs and water bottles to the receipt paper that you get at the grocery store, really personal care products, shampoos, makeup, all the things, unless you're using certified organic, are going to have xenoestrogens or endocrine disrupting compounds, and those can kind of mimic estrogen in your body and create issues where you're not able to detox your own estrogen or you recirculate it. So that could be one of the reasons, one of the things going on. Kind of loving your liver and healing your liver can be helpful. One of the like easiest things to do for helping with liver detox and helping to promote better hormone detox is a couple. So one, you can drink dandelion root tea. Dandelion root tea really helps to help your liver kind of clean out, helps it produce more bile, and that helps you have better bowel movements. It also helps facilitate the removal of all the gunk. Also milk thistle, taking milk thistle in a tincture, that can be super helpful to help support healthy liver detox, and that can help with reducing the effects of recycled estrogens, and also, of course, avoiding all of those xenoestrogens can be definitely helpful. Prolactin can also be an issue, especially if you recently came off birth control pills, or if you recently had a baby. Sometimes prolactin levels can be high, and that can kind of cause some issues with clogging milk ducts, sometimes extra cramping. And so reducing stress, eating anti-inflammatory diet, eating a lot of healthy fats and fiber, that can be helpful for kind of regulating those levels as well. Okay, let's see. What suggestions do you have for menopause depression? I started getting it 2 months ago and I'm 57. Thank you. Okay, so menopause depression, so very common. So our brain requires estrogen to use energy, to use glucose. So it requires it for that metabolic process that it allows it to use glucose for energy. When our estrogen drops, we do not have that ability as well, and our brain starts to form little plaques. I know that sounds super scary, but the plaques in our brain can cause things like difficulty thinking, confusion, hot flashes when they're in the hypothalamus, but it also can cause depression and anxiety. And so with depression, it's usually estrogen, low estrogen, and then with anxiety, it's usually low progesterone, because progesterone is very calming. Oh, just a moment. Hello there.
Actually, I opened up prize patrol.
Oh, the prize patrol is here. Come on in. Hi, Paxton. Do you have a prize?
Yes.
Okay, so Paxton is going to actually pick somebody to win a hormone balancing prize pack that's going to include our Daily Glow supplement, which is our daytime hormone balancing, thyroid supporting, and immune supporting, and adrenal supporting 1 a day all-in-one formula. And then also our Glow PM, which is our nighttime formula that is calming, has melatonin for supporting that antioxidant and sleep, and then also has a bunch of calming herbs, magnesium, and vitamin B. So that's in here. It's also going to come with a copy of my book. So all you need to do if you want to win, so if you're live right now, put your name, or to actually put Paxton's name, so Paxton, put his name in the chat, and then he's going to pick one of your names. So that's probably going to take just a second for us to see. So go ahead and do that right now. And if you're watching the replay, write replay Paxton, and we will pick one person watching the replay as well. So let's see. Is it coming in?
Paxton. P-O.
No.
What's that? Why did I say that?
I don't know if there's a little delay. There might be a little delay. Oh, so yeah, I'm starting to see them coming in. Okay, cool. Let's see. So we'll give them a couple more minutes. But what I was saying about depression is, so you can hold this and then wait a couple minutes and then come back and tell me a name. Okay. Oh, wow. They're all coming in. Oh yeah. They're all coming in now. Awesome, guys. So definitely one of the things that's really, really interesting is that when you look at the symptoms of chronic depression and you look at the symptoms of menopause, they are so similar. The fatigue, the low libido, the weight gain, getting sick more often. Oh yeah, there is a lot. You want to pick two? Yeah, okay. Tell me pick two names right now. Let's see. This one?
Yep.
So Edya Conrad. So EDYTA. I don't know if I said that right. Conrad. So all you need to do if we pick you is email support@glownaturalwellness.com and give us your address and we'll send you your prize pack. Okay, so we got Edya. And yeah, I'm sorry, I'm saying your name totally wrong. So definitely, and then Paxton, who else do you want to pick? Pick one more. Go ahead, just pick one. So yeah. Drum roll. And we have this one.
Yep. No. This one.
Okay, Jocelyn Mallory. So Jocelyn Mallory, just go ahead and email support@glownaturalwellness.com and we will go ahead and mail you your prize pack. So thank you. Awesome. Thanks, Paxton. All right, cool. Can you close my door?
Sure.
Thank you. All right, cool. And then if you're watching, the prize patrol is leaving. And if you're watching the replay, just write replay Paxton, and within like 48 hours, we'll give you 48 hours and we'll go ahead and pick a prize as well. But what I was saying, so back to depression. So with depression, the symptoms of depression, the symptoms of menopause are so common, so similar. And it's due to the drop of estrogen and progesterone. And so if you are in menopause and you're experiencing depression, before you go to an antidepressant, especially if you weren't depressed before, and this is something new for you as you're hitting menopause or perimenopause for that matter, I would start with replacing your hormones, because replacing your hormones not only can help relieve the depression, but they can also help with supporting bone health, supporting brain health, supporting heart health, helping with libido, helping with energy, helping with body composition, helping with your skin health, anti-aging, so many things. Actually, cancer.org and the American Association of Retired Persons and many other pretty prestigious organizations have released studies just in this past year that show that women who are on hormone replacement therapy actually live longer than women who aren't, and they reduce the risk of all-cause mortality. So all-cause mortality, what that means is dying for any reason. So you can actually reduce the risk of dying for any reason if you use hormone replacement therapy. And now I'm not pushing hormone replacement therapy because it's everyone's decision. On this channel, I talk about it a lot because not many doctors offer it. Actually, I did a recent video where I talked about where out of 500,000 women, only 75% of them did not get even offered the opportunity to consider replacing the hormones. And so I think that, definitely start with a healthy diet, exercise, sleep, stress reduction, looking at nutrients, like definitely start there. But all of those things are going to make you feel better and they're going to produce a healthier person. But the truth is that the human body, the female human body, wasn't designed to really live much past menopause. And so as the hormones decline, a lot of things start to deteriorate and break down in our body. And so in order for us to live that healthy, happy, vibrant life for the last third or even half of our life, because menopause, we go through menopause, average age is 51. Some women go through it much earlier. You still have another 50 years to enjoy your life, to have great relationships, to see the world, to have new hobbies, to start different careers. There's so many things that we can do, but we need our brain, we need our energy, we need to feel good about ourselves. And we have that opportunity. And the safety is so strong when you use bioidentical topical hormones in the right dose. And the dose and delivery method, super important. Oral hormones, not as healthy, especially oral estrogens, because those can cause issues with clotting. They can cause issues with metabolites, creating carcinogenic pathways. And so oral estrogen, don't recommend it at all. But topical hormones in the right dose, a physiological dose, so the dose that the body is used to getting, can be so restorative. So a little bit of a soapbox there, but hopefully I answered your question about depression. So I would definitely start with testing your hormones and replacing them if necessary before you go to antidepressants. Unless you have a long-term history of depression, then by all means, I'm not against pharmaceutical drugs. I'm not against antidepressants, but I'm against using them when the root cause is something else. So when there's an opportunity to actually build health instead of using something that's going to have side effects and might be reducing health, and then you still have all the symptoms of low hormones as well. Let's see, Melinda says, I'm 53 and my period stopped 8 months ago. I'm experiencing weight gain, anxiety, sleep issues, fatigue, hot flashes, vaginal dryness, extremely dry skin, dry hair. Yes, all of those. Definitely, those are very typical symptoms of, again, your hormones being depleted. At 8 months, you're almost in menopause. You could have another period and then you have to start the 12 months over again, but you're not ovulating, so you're not making the estrogen and progesterone anymore. And all those symptoms. The weight gain happens for several different reasons. So one of the reasons why we gain weight after menopause is because when our estrogen levels drop, we become more, when we eat carbs, we store more as fat. So we become more insulin resistant. And so we definitely want to, we can change the way we eat, but the chances are we're still going to put on some pounds. And so that's one thing. Two, as estrogen drops, our body is trying to somehow get us some estrogen. And one thing, our ovaries make estrogen, but the other organ in our body that also makes a form of estrogen is our fat cells. So our fat cells can actually make a form of estrogen called estrone. So there's 3 estrogens. There's estrone, there's estradiol, and there's estriol. So estradiol is the strong estrogen that does pretty much all the things that we think about. And then estriol, that's the helper estrogen that helps estradiol work better and also is anti-cancer, helps with moisture. So those are the 2 good estrogens. And then estrone, to date, so I always like to say to date, right now, we don't know of any benefit to estrone other than that it's made by fat cells. So in the future, maybe we will find something that it's good for, but we never replace estrone. We only replace estradiol and estriol. But estrone is actually made by fat cells. And if you can make enough estrone, once you have a whole bunch of it, it can make a little tiny bit of estradiol, so it converts over. So your body is saying, okay, let's see who asked this question. Melinda. So your body's saying, okay, Melinda, so you're not making any estrogen anymore, but I got your back, because what we're going to do is we're going to store a lot more fat than you ever stored before. And then we're going to hope that we can make enough estrone to give you a little bit more estradiol. So your body doesn't want to lose that fat, and it's a lot harder to lose it. Another thing that happens as we get older is sometimes our DHEA and our testosterone levels can drop too. Usually this happens after estrogen and progesterone drops, but everybody is different. It can happen before as well. And these hormones are really important for maintaining lean muscle mass. So when you go to the gym and you work out and you can develop some muscle on your arms and your legs, these muscles actually burn more calories at rest than just your fat cells do. So that raises your metabolism. Also, so that's another reason. And also when our progesterone drops, we tend to get worse sleep. And when our sleep is impaired or dysfunctional or not optimal, that can lower our metabolism by as much as 10 to 13%. Just not sleeping, just getting less than 6 hours of sleep per night. In addition, it increases our hunger hormones. So now we're hungry all the time, we're eating more. And the combination of not having enough muscle mass, preferentially storing fat to make estrogen, being hungrier, and our metabolism being lower, that all is a perfect storm for gaining weight. And so that's definitely part of it. And then the low libido, there's a lot of reasons for low libido. For women, estrogen plays a big role in low libido, but testosterone and DHEA can definitely be a part of it as well. So definitely test your hormones. With low libido, cortisol can actually be an issue as well. If you have high cortisol or you have a high amount of stress, we're in this fight or flight response, right? When you have high cortisol, it's a fight or flight hormone. And so if you think about, like, if you're running from a tiger, or you're running from a tiger, so like Stone Age, but let's say you're running from someone with a gun on a city street trying to come after you, you're going to have this surge in cortisol. You're running for your life. The last thing you're going to think about is getting sexy and, like, you know, having sex or having an orgasm. That's the last thing on your mind. And your body is not producing that whole kind of cascade of feelings and symptoms. So when we're chronically stressed, it's the same situation. We're chronically stressed, our cortisol stays high. So we're really not, we're shunting our blood flow to our extremities so we can run and fight, and it's not going to the nether regions. And so that's one thing. So definitely taking adaptogenic herbs can be helpful here if you are stressed or you're feeling stressed. The Daily Glow supplement that we're giving away, you can also order this on our website. That's super because it has everything you need in it, but it definitely has that stress reducing. Also improving sleep. So getting that progesterone balance, looking at the melatonin, doing that nighttime routine, that can increase libido as well. And there's been a study, and I don't have it in front of me, but I'll find it for you guys, where they actually showed that not only does melatonin improve sleep, but women that have higher levels of melatonin that take 5 to 10 milligrams of melatonin per day actually have increased libido. So you thought it was just testosterone, but melatonin just might be a libido hormone as well. Also, some other things that you can do, you can find these online. You can do some herbs. So there's some great herbs that can be helpful for increasing your libido, things like maca. So maca is a very popular herb for increasing libido. However, there's a lot of like drinks you can get that have maca in it that are powdered. I don't recommend the powder form. I actually recommend a liquid form. It's much more potent and it works better for libido. So you can get a liquid form. You can get it from, I believe Herb Farm. Herb Farm has a good one. We have I can drop a link below in the description box after this wraps up for a link to our online dispensary, which is all pharmaceutical grade supplements and herbs. And so maca is a good one. Also, Shatvari, I think that is a Ayurvedic herb that is great for increasing libido, reducing stress. And then there's another one called Damiana, and that one is actually really good as well. And there is a blend from Herb Farm that has many of these herbs in it. So it's called Libido Booster. So I'm not associated with that brand, but we do offer it on our online dispensary. So that can be something you can try. There's no hormones in it, but it can kind of help increase circulation and blood flow and give you a little bit of a boost. And one other thing that you want to look at, if you are experiencing low libido, you want to look at if you're taking any medications. So there are a lot of medications that have a side effect of lowered libido, among other things. So things like anti-anxiety and antidepressant medications, those are notorious for lowering libido. Blood pressure medications can lower libido, and also anything you're taking from GERD or acid reflux can also have a side effect of reducing libido. Now, that's not a comprehensive list, but what you can do is you just Google your drug and side effects or whatever it is you're currently taking, plus side effects, and look it up, and then just look at all the side effects. And if low libido is one of them, ask your doctor if you can get something else, something different. Also, low libido can sometimes be if you're having painful sex, if you have vaginal dryness, if you've had that in the past, like let's say last time you had sex, it kind of hurt because your vaginal tissues are getting thin. Perhaps you don't have enough lubrication. You might have some pain down there. That's not going to make you want to have sex next time, right? It's just not going to happen. And so addressing that pelvic pain, either with pelvic floor exercises, you can see pelvic floor therapists. If it's vaginal dryness, definitely using a lubricant. Use a clean, good lubricant, like a silicone-based lubricant. There's one called, you can get them on Amazon. There's one called Good Clean Love. That is a good one that's pretty clean. Vaginal estrogen, also great. So vaginal estrogen and vaginal DHEA, as long as they're bioidentical, amazing for restoring not only moisture to the vaginal area, but also reversing pain, reversing atrophy, helping the integrity of the tissues restore from not having the thin, paper thin skin down there that can cause tearing and also pain during sex. So those are just a few of the things that you can do to kind of restore libido. All right, let's see, let me get the next one down. Okay. Oh my God, everyone has packs. Oh my God, this is so cute. Whoever, JD, you had a cute little emoji. I think Paxton's going to want to send you a prize pack as well. And he sees that. All right, let's see. Topical hormones. Yes, Laura, definitely. So we always, in our practice, we always recommend topical hormones because topical hormones do not have to go through the liver. So when you apply hormones topically, and not all topical hormones are made equally. So there are a lot of progesterone creams you can get online over the counter from Amazon, but a lot of them don't absorb fully into the skin. And so they can kind of stay in the soft tissues and they kind of accumulate. And also when they don't absorb fully into the skin, they can be transferred to other people. The hormones that we use in our practice are really pharmaceutical grade, they're micronized, they're highly absorbable. And so they go cleanly into the skin with a matter of minutes. And they can be really effective because they go straight to the tissues. So there's no need to go through the digestive system, then go through the liver to have to break them down into metabolites and then go to the tissues. You actually can use a lot less when you use topical hormones and get a lot better results. So I would definitely recommend that. Topical and vaginal hormones, super helpful. What about oral progesterone? Oral progesterone is fine. Side effects are often like nausea, water retention, things like that. There's nothing necessarily wrong with it if you can tolerate it, but you do need to take 5 to 7 times higher dose than you would topical hormones. So a lot of women have issues when they get to that higher dose and they get nauseous, water retention, weight gain, stuff like that. But there's nothing innately wrong as far as like dangers with oral progesterone, as long as it's bioidentical. So you don't want it to be a progestin. Progestin, bad. Medroxyprogesterone acetate, bad. Those are the progestins and medroxyprogesterone acetate, the synthetic progesterones. Those are bad news. Those are the ones that even back with this study, Women's Health Initiative study, that was a study in 2002 that condemned all hormone use. It was the synthetic progesterone that was the problem. And so it does cause a lot of issues. So I don't recommend that at all. I don't recommend synthetic hormones at all because they're not what the body's expected, and they do cause problems down the line. And that you can't use them long term like you can with bioidentical hormones. Let's see. How do you deal with menopause and rheumatoid arthritis? Are they connected somehow? So rheumatoid arthritis is an autoimmune condition, and menopause is a natural decline of the hormones. It's a natural state. Every woman will go through menopause because at some point the ovaries will stop working. They're not designed to work forever. And at that time, estrogen, progesterone, and some of testosterone decreases. And so a lot of symptoms ensue. You can have increased pain from your rheumatoid arthritis, especially if you have joint pain. Joint pain can increase when estrogen drops. And so definitely there can be some correlation and overlap in the symptoms, but they're definitely two very different things. Autoimmune conditions require healing of the gut and more a systemic whole body holistic treatment, while ovaries not working anymore, those usually require hormone replacement. So hopefully that's helpful. Yes, this recording will be available as soon as this is done. Basically, it'll be kind of like packaged up however YouTube does it, and it will live on this YouTube channel. So if you want to share it, if you want to rewatch it, it'll be here forever. We will also email a link to the recording tomorrow. Let's see. I was prescribed Armour thyroid. I began to have joint pain after a few months. Not sure if this is a side effect of Armour. I would appreciate your thoughts. Well, anytime you start taking, I just dropped my iPad. Anytime you start taking something new, if you do notice a new symptom, then that definitely can be a side effect for you. So it could be that maybe you're not on the right dose, or it could be that there's something in the hormone that doesn't agree with you. You might want to try a different brand, or you might want to split up T3 and T4. It can be a coincidence, I guess, but I would talk to your prescribing physician and let him know or her know what you're experiencing, and maybe they can adjust dosage, or they can offer you an alternative. Because yeah, if you're experiencing something new, as soon as you start taking something, like within a couple of months, then, and you haven't started taking anything else new, and nothing else has changed in your life, like your diet, you didn't move to a new location, you didn't have more increased stress, look at all the other possibilities, but it definitely could be. It's not a like one of the common side effects. It's not like a known side effect, but just because it's not common doesn't mean it's not happening to you. We're all unique and individual. And so just like, a certain brand of magnesium might not agree with you, and might work really well for somebody else, or, you might not do good when you eat pears, but you do fine when you eat apples. And so don't discount how you're feeling, because there's probably something to it. So hopefully that's helpful. Let's see, I'm in perimenopause, still having a period monthly, 26 to 28 days. It has become incredibly heavy, large clots flooding over the past 2 years to the point where I'm bedridden. I am so sorry. That is definitely not acceptable. That is common, and it's not, the bedridden part isn't so common, but periods to become more painful, clotty, heavy, to the point where you're using multiple feminine care products like a pad and a tampon, and not being able to go to work. That is actually fairly common in perimenopause, because it's a symptom of basically estrogen dominance. So estrogen is the hormone that builds up the uterine lining, and then progesterone comes in and thins it back out. And when you have your period, if it's super heavy or super painful, usually that is due to the fact that your progesterone has started declining in perimenopause before your estrogen does. And that usually progesterone does generally, not the same for everybody, but progesterone generally does drop before estrogen does. So that you can definitely benefit from progesterone replacement. That can definitely be helpful. Other things to look at could be thyroid. Also could look at working on like an anti-inflammatory diet, and also the liver support that I mentioned earlier. So things like dandelion root tea a couple times a day. One, I like traditional medicinals, that brand, because they don't use any plastics in their tea bag. You can get that here where I live. Well, where I've lived for the past few years, I've lived in different places. It's always been available at like the local grocery store, or a place like Sprouts or Whole Foods, traditional medicinals. There's other brands that are good as well, but that brand particularly uses high quality herbs, and they also don't use any plastics in the tea bag. So I like that brand. So one tea bag of dandelion root tea gives you about 1,500 milligrams of dandelion root, where if you were to buy like a capsule, you'd have to take a bunch of capsules to get that. So super helpful. You want to put the tea bag in water, let it steep for about 4 to 5 minutes, and you can drink it. So that, and also milk thistle, can be super helpful for detoxing the liver. The reason why I'm saying this is because your liver is what needs to process the estrogen, so then it can be kind of packaged up and excreted from the body. That, and then also you might consider taking DIM, DIM, which is a compound that's typically found in cruciferous vegetables, but it also helps with that phase 1 estrogen detox. And then methylated B vitamins help with that phase 2. If you, my daily glow supplement does have both of those things in it. So it has the DIM and the methylated B vitamins. So it does support estrogen detox, but you can also source those things separately. So the reason why I'm saying this is because even if you have a normal amount of estrogen, if you're recycling it and you're not detoxing it properly, then that can create that situation. And then compounded with the fact that progesterone might be low, that can be creating that as well. So those are two things I would definitely start with. Of course, a healthy diet, anti-inflammatory foods, avoiding processed foods and sugar, all of those things are going to be important, but sounds like you need help like right now. So definitely optimize estrogen detox, get your hormones tested, add progesterone, definitely should help you a lot. Okay. All right, so talk about the ingredients in your compounded hormones, how much progesterone for 3 times. All right, so we do have, you can go to glownaturalwellness.com and click on the bioidentical hormone replacement. If you scroll down to frequently asked questions, you can see all the ingredients. And we will, in our program, we will customize a dose for you. So everybody's going to be on a different number of milligrams, just depending on what they need. Let's see. Okay, so Jennifer says she's been using progesterone cream and been using DIM for years. Have you had your hormones tested? I would definitely test your hormones and see what's going on, because I don't know what type you're using or if you're using the right amount. So I would definitely test. Let's see. Will topical cream bioidentical protect their uterus? Yes. So progesterone and estrogen are definitely important for uterine health. And yes, topical hormones, they get straight into your tissues, and a lower dose works the same as a higher dose of oral hormones. So yes, topical hormones do protect your uterus. What doses of milk thistle? So the brand I like, again, is Herb Farm. So HERB Farm. It's actually PHRM, I think. And it comes in a tincture. So 1 dropper full is usually what I'd recommend taking, but you can go anywhere from 500 to 1,000 milligrams if you're doing capsules. Or you can also get milk thistle tea sometimes, in a couple tea bags would be perfect as well. So with herbs, you don't really have to spend a lot of money on herbs. They're usually pretty inexpensive. Sometimes there's these formulas that will charge you a lot of money, but herbs, you can source them from local herb shops. Mountain Rose Herbs is a website that I'm not affiliated with at all, but I really like it. And you can get bulk herbs from them, make your own teas and tinctures. I'm going to be uploading a video to this channel really soon, so hit subscribe if you want to check this out. But it's going to be how to make your own herbal medicine. And so I did this part of Masterclass, an online event that I did a couple of years ago, and it's really, really popular. So I actually show you how to make a tincture, how to make teas and decoctions and everything. It's super simple. And I'm not the DIY person. So it has to be simple if I'm going to do it, because I much prefer to buy things than to get out all the ingredients and make them myself. But it's super simple. So I will share that with you guys within the next couple of weeks. I'll post that to this channel. Let's see. Any specific tests you recommend for hormone levels? So definitely want to test your estrogen, your progesterone, your testosterone, your DHEA. If you want to go a little deeper, you can test your hormone metabolites, which is a more extensive test, also more expensive. There's a couple of different companies that do it. One of the more popular ones is called the Dutch test. So it's DUTCH. It's not, has nothing to do with the country or the culture, but it's a dry urine test for comprehensive hormones. So that's a great test because it's going to look at a lot of stuff. So it's going to look at, of course, your hormone levels. It's also going to look at your hormone detox pathways, your metabolites. It's going to look at your melatonin, your cortisol levels. They do some random organic acids for B vitamins and things like that, and inflammation, but that's a great test. But if you want, if budget is a concern, you can just do a estrogen, progesterone, testosterone, DHEA. testing, and vitamin D as well. It would be great to test as well. And you can get that done through your physician. If you don't have a physician that will order it, you can order those tests from us as well. We have kits that you can do with either saliva or a little dry blood spot with a little finger prick, kind of like you do like diabetics do when they're testing their blood sugar. And it's mailed into a lab, the lab analyzes it, and we can give you your results that way. So it's a couple different options that you have. But we don't take insurance at our company because we keep the pricing really low. And by not taking insurance, we're able to do that. And we also can order whatever tests we want. We don't have to wait for insurance to approve it. But if you can get your doctor to order it, then I would start there. And so it's pretty simple. We also do blood testing as well. So if you prefer to go into like LabCorp or Quest Labs and get your blood drawn, we offer that as well. Let's see, is dry burning tongue a symptom of post-menopause? Can hormone replacement help with the symptoms? So yeah, actually burning mouth syndrome or a burning tongue or kind of a metallic taste in the mouth, that's one of the less common symptoms of menopause. So low estrogen is part of that. So low estrogen can cause that burning mouth syndrome or tingling or itching in the mouth. Also, low thyroid can also be a part of the kind of symptomatic or the root cause of the burning mouth syndrome. And then also, if you take any medications that have like high blood pressure medications like ACE inhibitors, that can also cause burning mouth syndrome. And then the other things, zinc, iron, and B vitamin deficiencies can result in burning mouth syndrome. And so those are just a few things, but estrogen depletion is tied heavily to burning mouth syndrome. So if this started happening as you went through perimenopause and menopause, then estrogen replacement can certainly help. But if you are taking an ACE inhibitor, you might want to start there. And also, making sure you're getting all your nutrients, all of that. Awesome. All right, let me see. I think I got all the questions. Let me just see. I had a couple questions that were sent in, but I think I answered them. How does estrogen affect your thyroid? So I actually have a video on this, but estrogen and your thyroid, they're kind of like Goldilocks and the three bears. So too much estrogen can cause problems with your thyroid. Too little estrogen can cause problems with your thyroid. Too little thyroid hormone can actually cause your ovaries to not work as well and not make enough estrogen, and too much thyroid hormone can make your ovaries work too much and make too much estrogen. So they do have like a symbiotic relationship. It's very Goldilocks, but with estrogen and your thyroid, so estrogen deficiency can actually result in too little thyroid hormone production, and then excess estrogen can actually result in buildup of thyroid tissue, and you can actually get something like a goiter or growth or nodule on your thyroid. So you really want to keep your estrogen balanced in the optimal ranges, and that will help you to have better thyroid function. So again, in menopause, too little thyroid hormone will result in not making enough thyroid hormone, and then too much, if you're over replacing, a lot of doctors that do pellets and some of these hormone protocols give you a ridiculous amount of hormones, and that can sometimes be more harm than good. So that can sometimes cause problems and affect other areas of your body. With progesterone, progesterone is also necessary for proper thyroid function. So too little progesterone can actually hinder the production functioning of your thyroid hormone. Too much doesn't really do too much to your thyroid, but you want to keep everything balanced. Let's see. Side effects of hormone replacement therapy. When you are taking the right dose, when you are using the right delivery method, and when you're monitoring your hormones, there's very few side effects. Sometimes when you first start hormone replacement therapy, especially if you haven't had estrogen for a while, you might notice some breast tenderness because your breast tissues are like starting to come alive. It's almost like going through puberty again. So you might notice some breast tenderness. You may have a little bit of water retention for the first 3 to 4 weeks. And that is because you're getting rehydrated, because estrogen is hydrating. So your skin's getting hydrated, your joints are getting hydrated, your blood vessels are now kind of increasing flow so that you can get the hormones throughout the body. Too much estrogen, though, that might cause painful breasts. Too much estrogen might cause, if you're still cycling, heavy bleeding. So you don't want too much. You want the right amount. And this is why we always recommend testing. I know there's a lot of doctors out there that say, oh, you don't need to test hormones. Hormones, you never test hormones in menopause because they're all low. Well, that's not true. We have women who are in their 70s that actually have high levels of estrogen. And it's from xenoestrogens, it's from possible tumors. There's reasons why hormones might be higher and you may not need as much. And then monitoring the hormones, how your body actually absorbs and uses the hormones is going to be very, very different from the next woman. And so when they're dosed and delivered properly and when they're monitored, there really are no side effects of bioidentical topical hormones. Oral hormones do have some side effects, and synthetic hormones do have side effects. And that's why you might hear that hormone replacement therapy should only be used for 10 years after menopause and then needs to be discontinued. It's because of the side effects of synthetic hormones and oral hormones. And so topical bioidentical, you can use them when you're being monitored and you're retesting. We test in our program in the Healthy Hormone Club, we test every 4 months, and then we reevaluate symptoms. So we're not just looking at the test results, we're also looking at symptoms. And then also we're also incorporating healthy lifestyle as well, because I never want to give the impression that you're just going to rub hormones on your skin and you don't have to do anything else and you're going to feel perfect. Because I go to the gym every day. I eat a healthy diet. I try to optimize sleep. I try to incorporate meditation. Am I perfect? Absolutely not. Do I always get all my water in? Not every day. But I do try to encourage all of my women to do these things because it's going to make your hormones work better. So if you want the very best results from your hormones, if you're on hormone replacement or even not, really in my book, Hormone Harmony Over 35, that is all the non-hormonal tips and tools to actually balance your hormones. There's actually a quiz inside so you can see which hormone imbalance you might have. There's information in every chapter is how to optimize each hormone naturally with food, with nutrients, with lifestyle. And then in the back, there's a 21-day program that has all recipes and kind of detox tips and all of that. And below this video, if you go back to the replay, you will see a link to get the entire book, a digital copy, completely free. So I'm not only advocating the use of hormone replacement therapy, although I am advocating that all women have that option. I'm a naturopathic physician at heart, so I also really encourage that healthy lifestyle and everything that you can possibly do to improve your health and your life. Awesome. So I think I got most of the questions. Let me just see. What do you do about hair loss? Hair loss is a big topic. I actually have a video coming out on hair loss in the next week or so. But hair loss can happen. There's many different reasons. So number one, there's genetics. So just like we never know at what age we're going to start going gray, we don't know at what age we're going to start losing hair. And everybody does at different ages. So you might be genetically programmed to actually start having hair loss. And there's not really a ton you can do about it. There are some new like stem cell therapies and peptide therapies that are coming out that can help with hair regrowth. But the reason for hair loss, it could be genetic. Another reason for hair loss is stress. So the interesting thing about stress is that if you have a stressful event today, your hair will actually start falling out 3 months from now. So hair is like 3 months behind of whatever you're currently doing. If you start doing things to improve your hair today, 3 months from now is when you're going to see the benefit. So that's important to note. So stress is definitely one. Nutrient deficiencies. So if you're not getting enough protein, if you're not getting enough vitamins and minerals, hair will definitely start falling out. If you're on a really restrictive diet, we see this all the time. I work with some fitness competitors and some athletes when they are in their cutting phase or they are in their dieting down phase, hair loss happens within 3 months of that. So nutrient deficiencies, making sure you're getting enough protein. Protein is what our hair is made out of. Excess testosterone or testosterone breaking down the more androgenic pathway. So testosterone can break down two different pathways. It goes like this. So you can have the A pathway or the B pathway. The A pathway, that's the more androgenic pathway that goes to DHT. So DHT, you may have heard of it. It's usually associated with men's prostate issues, but DHT is what makes the androgenic symptoms. So the hair loss, acne, lowering of the voice, weight gain, irritability. So your testosterone breaking down that level. And if you have PCOS, where you have higher amounts of testosterone, or it's breaking down the more androgenic pathway, what you can do is you can take a herbal supplement called saw palmetto. There's actually a combination that we use in our practice: saw palmetto, pygeum, and nettles. Those three, saw palmetto, like a saw, palmetto, pygeum, and nettles. So those three together actually work really well at pushing that pathway in the other direction. There's also a pharmaceutical, spironolactone, that is used to help do the same thing, but that just have some side effects. So I always prefer the natural herbs. So that's another reason. Low thyroid, notorious for hair loss. So if you have hypothyroidism, even subclinical hypothyroidism. So what I mean by that is, if you go to the doctor, they do a thyroid test and they say, oh, your thyroid's normal, but it's not optimal. So I'm looking for optimal thyroid levels. If you look at your T3 reading, if it's lower than 3 or lower than 2.9, chances are you have subclinical hypothyroidism. And so looking at that from a functional perspective and optimizing thyroid can be super helpful. You can support thyroid with things like selenium, zinc, iodine, but if it's super low, you might use a thyroid glandular. There's some that are available over the counter, and then there's also pharmaceutical prescription like Armour Thyroid, or you can use a medication like Synthroid or Cytomel. So those are some things. And so I said stress, nutrient deficiencies, testosterone pathways, thyroid. Sometimes low progesterone can cause hair thinning. Not necessarily always the case. Progesterone and estrogen can help your hair grow better, but usually the hair loss is going to be from either thyroid or something else. So those are some of the reasons why you might be losing hair. There are a lot of like hair thickening shampoos, scalp massage with rosemary oil can be super helpful for regenerating the kind of reinvigorating the follicles. So rosemary oil and peppermint oil to kind of reawaken the follicles. Doing evening, nightly massages can be helpful. And then there is a over-the-counter, not natural, but effective remedy for hair loss. It's called minoxidil or Rogaine. It's available over the counter. You'd have to apply it every night. You have to be really careful when you apply it, because if you apply it and it gets like here, you'll start growing hair on your cheek. So I don't usually recommend this, but I'm a fan of giving you all your options. So this is an option. It does work. Usually takes about 3 to 4 months to see it working, but you have to continue using it pretty much forever. And you have to use it, I believe, every night. But I think once you get to the maintenance phase, you can use it like 3 or 4 times a week. I'm not 100% sure because I don't typically recommend it, but I just wanted to give you that option because I know that hair, if it's genetic, there's not really much you can do. If it's hormonal and we fix the hormone issue, then in 3 months, your hair will start growing back. If it's thyroid and we fix the thyroid issue, in 3 months, hair will start growing back. Same thing with nutrition deficiencies, same thing with stress. If it's genetic, there's really not much you can do to make it grow back. So, but definitely get your hormones tested, see if that's an issue, get your thyroid tested, see if that's an issue. We do offer those tests if you can't get your doctor to run those for you. Let me see if I missed anything. Supplemental won't necessarily lower testosterone, but it'll push the detox pathway. So it'll move it over. Now, if you have high testosterone, make sure your progesterone is optimized, because progesterone and testosterone are kind of like, they kind of counterbalance each other. So sometimes when progesterone is low, And also when estrogen's low, especially in menopause and perimenopause, when estrogen and progesterone get low, even if your testosterone is normal, you're going to be what's kind of like testosterone dominant, and the androgenic symptoms are going to be more prevalent. So bringing your estrogen and progesterone up can balance that out as well. But taking methylpalmitoyl pygeum and nettles, those will help to push the pathway of the testosterone breakdown, but won't necessarily lower the testosterone number. Where can I find hormone tests on your website? So to be honest, you actually probably can't right now because we were only offering them as part of our programs. But over the past week and a half, so many of you have asked for individual tests that you can go to our website, you can go to shop, and you can go to lab testing. You can see a bunch of different tests. But for a specific hormone test, that's not the complete Dutch test. That's very expensive. If you want individual hormone tests or just a hormone like estrogen, progesterone, testosterone, DHEA, we will be adding that very shortly. So give us about 3 or 4 days and we'll have that up. But thyroid's there, vitamin D is there, gut tests are there, all the other testing is there right now. So you can definitely do that. But you can also email us at support@glownaturalwellness.com. Support, SUPPORT, at glownaturalwellness.com, and we can facilitate that for you quicker. Let's see. If you're age 20 and have menopause, PCOS symptoms, along with crazy physical and mental symptoms, what would be the next step for her? Oh, okay. So 20 years old, menopause symptoms and PCOS symptoms. So I was 20 years old and I actually was diagnosed with primary ovarian failure. So I was actually told I was in menopause at age 20 and that my ovaries were done. So I had all those symptoms, and I went to like 7 different doctors, probably more, and they all told me the same thing. There's nothing you can do. And I went through life just believing that I'd never have children. I would cry at the Mother's Day commercials on TV. And I also had a lot of other issues. I had gut issues. I had food sensitivities. I had heavy metal toxicity that I didn't know about. So there's a lot of other issues also going on. So as I got older, I just really wanted to try to fix my gut issues because those were really starting to bother me. And so I went to a nutritionist and I started working on like removing gluten and removing dairy and doing some of those things. And those helped a lot. So I started feeling better with my gut. And then I ended up going back to medical school, became a naturopathic physician, and learned about like metal toxicity and mitochondria health and blood sugar levels. And I realized I was exercising too much and in the wrong way. And I was eating all this low fat food in the 90s. And I started changing my diet to be a little more healthier, and overdoing all these things, like everything started to normalize. I went through a heavy metal detox, parasite protocol, all these different things. And my hormones actually started coming back. So it wasn't really ovarian failure. It was actually a misdiagnosis, but I had all those menopause symptoms. And so the reason why I'm telling you this is because the Glow Protocol program is actually what I did. I actually created the Glow Protocol out of me having to go through all of those things to fix myself. And so I would recommend, if you go to our website, there's actually, if you go work with us, there's actually a free like 4-part video series called Natural Healing Made Simple. I would recommend she watch that and kind of relate to me. And I talk about how working on the different areas of your body can actually really help with that. Because for a 20-year-old, they generally don't need replacement of hormones. They need to optimize how their body is using their hormones. And what PCOS is usually, doesn't have to be. PCOS is a syndrome. So it can mean that there's cysts on the ovaries, but doesn't necessarily have to. You can have PCOS without cysts on the ovaries. Sometimes it's excess testosterone and DHEA. It doesn't have to. Irregular periods and weight gain. And you just have to have 2 of those symptoms. Like you don't need to have all of them in order to be diagnosed with PCOS. But looking at diet and lifestyle are going to be the biggest needle movers for her. Looking at any underlying infections, exposures, toxicities are also going to be important. Will you reply to unanswered questions later? I'm trying to answer all the questions, but if I don't, yes, I will reply to the unanswered questions later, or I may make another video if it's more in depth and can't be really answered in a quick reply. Let's see, I did my Dutch test. All my levels were low. My adrenals were low. I can't eat anything because I get awful temporal headaches. Okay, so you definitely need help. You definitely need to work with a practitioner or someone who can guide you through. You likely can definitely benefit from hormone replacement therapy, taking adaptogenic herbs. With low cortisol, also licorice root can also be really helpful. So it's a little tincture that you take. There's actually a great blend by a company called Bioidentical that's called Loving Energy, and it gives you just a little boost to your cortisol levels without any jittery feelings. So that could be super helpful. But I would definitely, sounds like there's a lot going on, so you definitely want to get some help there. You don't have to suffer. What causes breasts feeling much heavier and getting bigger as you age? Well, it could be estrogen dominance. It could also be just weight gain because we have a lot of fat tissue in our breasts. It could also be fibrocystic breasts. So you might be getting some cysts or some fibroids in the breast, usually due to either estrogen dominance, liver toxicity, or improper estrogen detox that we talked about earlier. So that could be a possibility as well. All right, so I'm doing some silly comments in the chat as well, but I'm going to go ahead and wrap it up here so that we don't drag out. I want to respect your time, but if you did ask a question, please let me also comment in the comments if there's any topic you want me to cover in an actual video, like an 8 to 10 minute video to give you kind of all the bullet points. I know I can kind of gloss over the questions here on the Q&A and I can give you some really great answers, but if you want more details on any topic, definitely put them in the comments. I love answering your questions. It really gives me inspiration. And please share this channel with your friends and any women that you think can help, because that's what this is all about, is the women helping women. So thank you so much for joining. Definitely hit subscribe so that you can get the upcoming videos. I'm going to definitely do one on low libido. I'm going to do one on how to deal with fibroid cysts and things like that. And many, many more videos coming up. So thank you so much. Have a great night, and I will talk to you guys soon. Bye-bye.